to everyone for joining us today. This is FMLA at 30, what workers may not know but should, and what's to come for paid leave. I want to start off first with just a little bit of housekeeping for everyone. So as you just heard, we will be recording today's webinar. So I want to make sure everyone knows that. We'll also be sharing out resources that are mentioned on today's webinar in a follow-up email to all who registered. So no need to go searching for all the resources mentioned. We will follow up with all of those details so you have them right at hand. And finally, we'll be taking Q&A at the end of the conversation. So please feel free to put questions in the Q&A box. We'll be following along and we'll try to address as many as we can at the end of the webinar. Now, I am so excited to introduce our incredible panel that is here today for this conversation. I'm going to read some really wonderful bios of these remarkable people with us today, and then we're going to launch into our conversation. So I'm going to start with Wendy Chun. Director Chun serves as the 20th director of the Department of Labor's Women's Bureau, appointed by President Biden in February of 2021. Wendy is skilled at coalition building, bridging strategy across grassroots, community organizing, and public sector policymaking at state and national levels. She has held senior positions in Maryland state government and private philanthropy, overseeing large-scale, results-driven initiatives for worker and family economic justice. Prior to joining the Women's Bureau for 10 years, Wendy led Family Values at Work, a national network of grassroots coalitions that have won more than 60 new paid leave policies. We are so honored to have you here, Director Chun. Thank you so much. Next, I'm going to introduce Sharmili Majmudar, who is Executive Vice President of Policy, Programs, and Research at Women Employed in Illinois, where she oversees Women Employed's development and implementation of strategic policy and system change priorities, advancing economic justice for women. Before joining Women Employed in 2017, Sharmili served for almost a decade as the Executive Director of Rape Victim Advocates, whose mission is to ensure that survivors of sexual assault are treated with dignity and compassion. Aisha Wells is the Director of Organizing for Mothering Justice in Michigan. In this position, Aisha organizes with mamas of color in the community to understand the mama's agenda issues in the workplace to help pass economic justice policy. Before working at Mothering Justice, Aisha interned at the NAACP, helping with the Freedom Fund dinner and monthly membership meetings, and has advanced and advocated for her disabled son, Alex, since 2006. Sherry Leiwant is co-founder and co-president of A Better Balance, a national nonprofit legal advocacy organization that uses the power of the law to advance justice for workers so they can care for themselves and their loved ones without jeopardizing their economic security. Since 2006, Sherry has co-led A Better Balance's pioneering efforts to advance fair and supportive workplace legislation, such as paid sick time and paid family and medical leave, and to combat pregnancy and caregiver discrimination in over 40 states and localities, as well as for new exciting federal laws, such as the Pregnant Workers Fairness Act and Pump for Nursing Mothers Act. We are so honored to have our panelists here with us today. I should probably also introduce myself. I'm Sarah Brafman, National Policy Director at A Better Balance. And that's probably the most you'll hear from me today because I want to turn it over to our wonderful panel. And I want to start with a series of questions. And I'm going to pose the same set of questions to all the panelists because I think each of you has a unique perspective here. So the first piece of this conversation that I'd love for us to address is how has the Family and Medical Leave Act been vital to the workers that you serve? And digging a little bit deeper, what have you found to be effective ways to reach workers about their leave rights? And is there anything that's really surprised you in doing this outreach work over the last many years? So Director Chun, I'm going to turn to you first for that.
Thanks so much, Sarah. Sorry, I couldn't find the mute button. It's really good to be here with all of you today, and thanks for all the work you're leading across the country. I mean, I think what's obvious to all of us, including the Department of Labor, as we implement this historic Family Medical Leave Act, over the past 30 years is that the need for leave is really universal. And yet the policy that protects our country, the Family Medical Leave Act, isn't universal, isn't able to be accessed by all workers, because the policy doesn't go far enough to really reach all workers or cover all workers. So I think the important thing that we're looking at now, 30 years into implementing this law, is how, all the ways in which it needs to be improved and updated to really reflect how workers live and work today. I'd say that's something we think about all the time.
Sherry, do you want to jump in next on this?
Yeah, I mean, we at Better Balance, in addition to our advocacy work, we run a legal clinic and hear from workers all the time, every day, really, about questions about their leave rights. And I will say the FMLA is incredibly important, when people learn that they are protected, their job is protected if they have a new child or are seriously ill themselves or have a seriously ill family member, that it's just a game changer for people in terms of their psychology, in terms of their ability to deal with the issues at hand in their lives. Which makes it even more, as Wendy was saying, distressing that this is not something that covers everybody. And we do also hear from, about 40% of workers in the United States are not covered by the FMLA. And that's because there are carve-outs for smaller businesses under 50. And for us, I mean, what's been a surprise in some sense is how important also the provisions that restrict eligibility if you haven't been at your work for the same employer for 1 year, or worked for 1250 hours for one employer for 1 year, how important those barriers are, especially for low-wage workers who may change jobs frequently, who may be piecing together many jobs, so they may work full-time, but 1250 not for one employer. So it's always very, very distressing to tell people that they're not covered. So, and I think that's one thing that is surprising. I think the other thing is that what I want to communicate too is that for your own medical condition or taking care of a seriously ill family member, you don't have to take the leave in one block of time. That is true for bonding leave, but it is not true for your own for the medical needs that you may have for you or your family. And that can be incredibly important if you're pregnant and you need prenatal care, or you need bed rest, if you have cancer treatments that you need to go to, if you have a family member who's in the same situation. That leave can be taken in little chunks and does not have to be taken all at once. And that also is a game changer for a lot of people. So just wanted to share that as well.
Yeah, I'll just continue what Sherry was saying. I think about the time that I had to use FMLA for my son when I worked in a different industry before Mother and Justice, and how incredibly helpful it was to be able to take my son back and forth to physical therapy and occupational therapy every single week and use it intermittently. I think I don't know if it's surprising, but I think what we've understood is that we really have to meet folks where they are. And where is that, right? How do we meet folks where they are? And I think that's a statement that we make oftentimes, but we don't really understand what that means. And so that means showing up to to the playgrounds, to swim practice, to wherever those workers are, to help them understand what their rights are. Is not very linear, right? You're not at work learning about work oftentimes. Usually you're at your dining room table trying to figure your life out. And so, or you're talking amongst friends, or you're at some sort of social event trying to understand how the heck I'm gonna take off from work, right? And so I think that that's the best way to get the rights out there, help with implementation, and help folks to get the best understanding of what's available to you. I think oftentimes I didn't know what FMLA was, and I think that's on purpose, right? I don't think that's by accident. I don't think that it's out said as much as it could be possibly said. And so I think the other thing that we try to do at Mother and Justice is help with implementation and get into spaces like I mentioned before, where folks are just wanting to know what is going on and to be as helpful as you can and relate to the folks that you're in community with.
You know, I'll just build on what has already been shared and say that, you know, FMLA provided a floor, and it provided an affirmation of the fact that caregiving and work were happening at the same time. And I think that's critical. I don't think we can minimize that. And as everyone's noted, it was a start, and it was a floor that was very set at a very low level in a lot of ways. We've found, particularly when there was kind of COVID specific leave, what we really tried to do with our outreach was, I think, like Aisha said, reaching people where they were. So we went with community specific newspapers that weren't in English. You know, I think you have to get very, you really have to bring the word to people and not be expecting that people are gonna get it just because you're using a mainstream medium. We've also been finding that you can get creative, like Spotify. We're using Spotify not for leave right now, but we're using it for something else that we're working with the Department of Labor on related to pay equity. And it's just a new way of reaching out and potentially being able to target different groups of people as well. So I think we constantly have to be creative and realize where is it that people are getting information with that. I think one thing that's always surprised us is how much confusion there is about the issue of paid leave. And frequently that confusion is on behalf of the people who actually have access, that they assume that other people have access. And I don't think that those folks who have been in the position of privilege of having access to that leave don't always understand how much of a privilege it is. So I think that's part of our educational work as well.
Yeah, and I just wanted to add, I mean, I think that it is definitely an issue that there's just an array of laws and protections, and it's very hard for people to, you know, kind of, because people don't think, oh yes, well, you know, I have this civil rights problem, or I have this, you know, this leave problem, or, you know, I have this pregnancy problem. So we do have a hub on our website, which I think has been very effective, a state-by-state hub of all the rights around workplace rights, around leave and around parenting and pregnancy and own medical illness, and that's been visited a lot. It's state by state, so people can look at what their federal rights are, what their state rights are, and what their local rights are. So I think that's been important. You know, just you know, as has been said by Sharmili and Aisha, I mean, community groups are just so important in getting the word out. Providers of medical care, unions, you know, people who organize workers, and using, you know, being creative, using social media, I think is something that we've been trying to really figure out what's the best use of you know, of the social media platforms that we could use to get the word out about people's rights. And also just, we do a lot of outreach and education, a lot of trainings. Shout out to Women's Bureau and DOL for the FAIR grant that's enabled us to be in upstate New York, where there are very few resources, and get a little deeper into really training and letting people know about their rights. But, you know, really trying to think through who are the people who are going to bring this information to other people as well. And I think that's been said already as well.
Well, thank you all. Before we go to the next question, Sharmili, can I just ask you what it looks like to do outreach work on Spotify? That sounds really interesting. So I think probably many folks are curious what that means.
Yeah, so I mean, we have to recognize it's a one-way kind of communication vehicle, but again, shout out to the Women's Bureau. We're working with the Illinois Department of Labor on a FAIR grant that's related to pay equity. And so our focus there is just getting people to realize that there are equal pay rights that they are entitled to. So it literally, and Spotify is one of those media that if you're not a paid subscriber, you have to listen through the ads. So it's a captive audience. And so we've had a 97% listen through rate. So for the ads that come on, they're listening to the whole thing because they have to in order to get to the song that they want to listen to, right? And you can target, you can target geographically. There are lots of other ways. So we're learning a lot right now. But we're excited that this is, potentially another way to get the word out about what people may need to know.
Thank you so much. That's really creative. All right, I want to pivot a little bit from the outreach work, and thank you for sharing also what's been surprising to workers around things like intermittent leave and the ability to use FMLA for prenatal appointments, postnatal appointments. I think a lot of folks don't know enough about that, and it's a really critical protection. So thank you for that overview. I want to turn back to you, Director Chun, to talk a little bit more about the DOL's work on the importance of evidence-based leave policies.
Yeah, happy to. Thanks, Sarah. I mean, I sort of said this one in response to your first question, but just a simple acknowledgement that the leave for the need for leave is really universal, but access to it, as each of you just said in your own way, is really unevenly distributed by race, but also across industries and income levels. So just recognizing that only 1 in 4 private sector workers had access to paid family leave through their employer. Only 2 in 5 have access to short-term disability insurance through their employer. And what that means for the lowest wage workers, which predominantly these are women, workers of color, is that 9 out of 10 workers have no access to paid family or disability leave through their employers. And this is a problem from the Women's Bureau's perspective because women are more likely to need leave. We are more likely to have an unmet need for leave. We are less likely to receive pay while on leave if and when we have to take it, and if we can take it. Women are working in service occupations. These are some of the least likely to have access to paid leave, these kinds of jobs, and but still, are among the most likely to report having needed some form of leave but not being able to take it. The largest share of women who needed leave but didn't take leave reported needing to take that time off for their own illness or medical care. So these are not trivial things, right? And why can't we take it? Because taking unpaid leave is just not an option. So, part of the Women's Bureau role is really documenting these needs and keeping various stakeholders, including policymakers, focused on these needs. Going back to 1995, Department of Labor has been regularly fielding large-scale nationally representative surveys of workers and employers that really equip us with an important picture of FMLA coverage, knowledge about the program, as Sharmili, you were just talking about, also about access to the program, and certainly about perceptions that workers and employers have about the program. And really, in doing so, these kinds of surveys are helping us understand what is the reach of the current law, but also what are its limitations, which is a lot of what you just said. We know that there are critical gaps in workers' knowledge about the law. More workers sometimes, thinking that they're covered by the law, but then actually are covered by the law. That's an issue, but also really focusing on the need to keep educating workers that they can use the FMLA when they have family caregiving needs, when they have mental health needs. And so the Department of Labor really across many of our agencies is focused on making sure, really promoting the ways in which you can use the FMLA over these several months, having just celebrated the 30th anniversary of the FMLA. and understanding that we still have more to do in terms of making sure that workers know their rights. And I just, maybe I'll shift a little bit, knowing we absolutely know that having access to paid leave is about ensuring economic stability and providing critical support for workers and our families, but also for employers and for our communities and our economy overall. You can pick up any study on paid leave and really understand that it's about improving child health and well-being, and certainly maternal health and well-being, and also families' economic security, retention, labor force retention, and participation. And then just to reflect the work that I know you all are leading across the country, paid leave is working, right? For many of your states. It's working for businesses big and small. It's working for the federal government. And so just to reflect a bit on the fact that the FMLA, Sherry, you said this in the beginning, is hugely important policy, but also needs, it's come high time to think about updating and really ensuring, and this is what the evidence shows, that the leave be affordable for all workers, for all kinds of needs that we've talked about, for all of our families, that it's accessible. So thinking through the fact that workers need to be paid during that time, and that it's also hard to live on a minimum wage. And so thinking through how we replace the highest amount of wages for some of the lowest earners, making sure that the important in the FMLA is job protection. So really thinking about an effective paid leave policy that has job protection, and just sufficiency of the time off to reflect the kinds of needs that we need paid leave for. And so I will end by saying there are a couple of things that have been really important to invest in, not just the survey tools like the American Time Use Survey, but it's why the Women's Bureau actually invested in a grants program a couple of years ago to really support states that were looking to study how they would establish paid leave programs. As a result of that grants program, I think 3 states passed laws and 2 of them expanded laws or improved upon their policies. And then a couple of them actually saw paid leave pass in their laws in subsequent years after the grants. Women's Bureau has just launched, and Sarah, I think you have the link probably handy. I could also try to chat it in, but we just launched a brand new paid leave website that really provides information about these different kinds of leave and the benefits of paid leave for working families. And the website highlights, of course, the steps that several states have taken to create paid leave. And then I'll end by saying, just reflecting back, the FAIR grant, the Fostering Access, Rights and Equity grant that several of you have mentioned, and I know are working on, that the Women's Bureau has currently. So Fostering Access, Rights and Equity is really a grant program that is about launching and expanding projects to help workers, and really focused on low-paid, low-earning women, to make sure that they do know their employment rights, that they are protected, and that they have access to all the benefits that are available to them. So thanks for the question, Sarah.
Thank you so much, Director Chun Hoon. I'm going to turn to you, Aisha, to delve in a little bit more into what's going on in the states and talk a little bit about the paid family and medical leave effort in Michigan specifically, and paid sick time effort. Talk to us a little bit more about that. And then Sherry, I'm going to turn to you to take a step back and give us a sort of landscape view of the state of paid leave, both nationally and at the state level, and what we can expect in the next year or two. But let me turn it to you first, Aisha.
Thank you so much for asking us, Sarah. Michigan is how I'll start that off. I'll talk about 3 things. First, I'll talk about paid sick time in Michigan. So currently, Michigan does have a paid sick time law. It was passed back in 2018. However, it was gutted by our Michigan legislature, and all of the good parts that reached more employees, more workers, employer sizes, a number of things was gutted and taken out, right? And it hasn't been able to spread widely across the state as we had hoped it for it to be, right? And so we've been fighting against what was taken away from the will of the people. It came through as a ballot initiative, and we got over 400,000 signatures for that, right? And so what does that mean? That means that they circumvented the will of the people, right? The will of the people say, yes, I want paid sick leave, right? Easy, right? Not hard to think about. And then our legislator was like, not for everybody, and no, you don't. And so they took out some good parts. And so ever since then, we have been going through the court systems. We have, first we won in the first court system in the claims court, and we asked, and the judge was like, yes, absolutely. And then we went to appeals court, and then that was a different group of judges who said, no. And so it went back to the language that the legislature gutted. And so we are fighting in Michigan right now for it to go to the Supreme Court, and hopefully the Supreme Court will recognize what the will of the people asked for back in 2018. So that's what we are diligently fighting for in Michigan. We have a coalition, Michigan Paid Leave for All Coalition. We have a steering committee that has been working to educate the community, to help them to understand what was done in 2018. And we've been gaining support on it ever since then, with our lawmakers, with our community organizations, with unions, with everyone who we tell this story to. It's always just, what? And and everybody wants to be involved in this being restored to the original language. From that being, from the legislature gutting the bill, they changed the name. They changed the name for it to say paid medical leave in Michigan. And that in and of itself is an issue. And so what we're also tasked with now is educating the community on what is paid sick leave and what is paid family medical leave. And like creating a task force, creating a working group, as we were all kind of chatting about before the call started, is creating educational webinars and a place like how we are today on educating folks, like what is the difference between sick time, what is the difference between paid medical leave. Both are leaves, right? We know that, but one is for a shorter amount of time and one is for a longer amount of time, right? One is for paid medical leave is to welcome a new child, is if you have a chronic illness, is to care for your named family and a loved one, right? It's equitable, and it reaches far more folks, right? And I'll let Sherry talk more detail in that as well, but that is what we are first working on, is educating our community on what are the differences between that. When the legislature circumvents the will of the people, they also do a disservice by renaming it to something that is not true, that is not factual, that is misleading, which we always see happens in our communities. People are unsure of what things mean, and it's easy for them to tear the name up and make it something cute, but it's really not what that means. And so we're working on educating the community on what the differences are, and hopefully that helps with passing new legislation, which we're working on paid family and medical leave in Michigan. And so we're hoping that in Michigan, something happened that hasn't happened in 40 years, 4 decades. We have been able to have a Democratic governor, Democrats are in the House and in the Senate in Michigan. And so we've done something which people like to call the trifecta, right? We have not done that in a number of years in Michigan. And so we are hopeful that we are able to pass paid family and medical leave in Michigan, and that we are having both of these laws put into place so that we are here for the workers and for the caregivers. I myself am a caregiver. I have to get my son off the bus. And so we understand how important it is to care for caregivers. We want them to be able to take off from work securely, to be able to retire, right? Instead of depleting all of our savings accounts to care for our children, depleting all of our resources to make sure that we are taking care of the folks who we love and care for, and those same folks who are loving and caring for us. And so in Michigan, we are doing those 3 things, and that's what we are working on in Michigan. So, that's why I started with old Michigan.
Thank you so much, Aisha. Aisha's gonna leave us for a couple of minutes to get her son off the school bus, and then she'll come back for Q&A as well. Thank you so much, Aisha,
Thank
for
you.
being the amazing caregiver and advocate that you are. So Sherry, I want to turn to you to sort of take a step back and give us this landscape overview of state paid leave laws currently in place and what we can expect in terms of advancing paid leave in the next year or two.
Yeah, and shout out to Aisha and all the work that Mothering Justice has done in Michigan over the last decade, really, to improve leave there, in very difficult conditions, and really excited about the prospects for the future there. So yeah, I mean, just starting out with the federal, we have, of course, we're extremely disappointed that we were not able to get a paid family and medical leave program over the finish line in the Build Back Better proposal last year. And also I think everyone knows that the congressional prognosis is fairly grim for federal legislation on this during the next 2 years. But I do want to say that there are so many champions that we have both in Congress and in the administration. And we expect, as you could hear from Wendy, that this issue will be kept alive and that really we'll be in a position to address it. And this will happen, if not in the next 2 years federally, then soon. And we'll also be working over the next 2 years to try to make improvements in the FMLA that we were talking about just previously, to make the eligibility criteria better. Both in terms of the business size carve out, but also in terms of the attachment to the labor force requirements that leave out so many people who are working really hard and who really do need the coverage and protection of the FMLA, as well as to try to increase and expand the definition of family, which is very, very narrow. It's a 1993 law, 30 years. Families look different now in the United States, and we want to make sure that all loved ones can be cared for under this law. But turning to the states, really on a brighter note, I mean, I think that there is so much activity in the states and localities right now around paid family medical leave, as well as around paid sick time. With respect to paid family and medical leave, there are currently 12 states, including the District of Columbia, that have passed paid family and medical leave programs. And as as Aisha was talking about the difference, paid sick days is paid for by the employer for an illness or an occasional need to take time off to take care of your preventive or medical needs like flu or a virus or stomach problem or your children being sick. But paid family medical leave is much more long-term and really requires a framework in the state or locality to be able to process payments and to be able to ensure that there is extended leave available. And most of the states that have been passing these laws have gotten 12 weeks of leave for these really important purposes, like bonding with a new child, seriously ill medical condition, taking care of a seriously ill family member, certain military needs, and we're even seeing now states passing domestic violence purposes as well. And it's just important to say that in these 12 states, these laws are helping millions, literally millions of workers care for themselves and their loved ones. And they're proving to be really successful. And they're workable for both workers and businesses. We're not hearing complaints. I would urge you, in addition to the incredible work that's being done in Michigan, that you just heard about, in Illinois, which you'll hear about in a minute, by organizations like Mothering Justice and Women Employed. There'll be other states as well. Keep an eye on Minnesota, keep an eye on Maine and New Mexico this year, and then in future years, there will be more states. Oregon will come online this year, and Delaware and Maryland, which passed their paid family medical leave laws last year, will be moving towards implementation the following year as well. And I'd also say we're working to strengthen existing paid leave laws. It's once you pass them, and they're so popular and they serve so many important purposes. There are ways to really improve those laws, and that's happened in California and in New Jersey, and we're working now in New York to improve our medical leave law there. There's talk of ballot initiatives in a lot of states, despite Michigan's unfortunate experience with the ballot initiative in 2018. Ballot initiatives can really be a vehicle. That's how we passed paid sick days in Arizona. It can be a vehicle for getting what people want, the people want, and legislators are ignoring. And in many states, that is the case. You're not going to get something through the legislature, but there is the possibility of going to ballot. And another exciting trend I just want to mention is that there really seems to be a movement right now to improve and expand paid leave for public workers. And that's very important because there's a diversity in the public workforce. And it's something that states are interested in that you wouldn't expect. Many southern states, many localities. Birmingham, for example, just passed a very good parental leave law, 12 weeks in January. Cincinnati is doing the same. So in some states where prognosis is not good for getting a broad bill passed for all workers, there's a first step being taken for public workers. And we really feel like that can then be kind of translated into something that all workers will be able to receive. Because once it's there, once you see how important it is and how effective it is, I think that it is a good step towards then trying to get these leave laws done in the states. And ultimately, of course, our goal is to have paid family medical leave for all workers in the United States.
Thank you so much, Sherry. It's hopeful to hear about so much progress and continued progress. So thank you. And Sharmili, I want to turn to you now and put the focus on Illinois. I know you all had a big win with the passage of the Paid Leave for All Workers Act. So would love to hear more about that and kind of speak to what Aisha was talking about in terms of the differences between paid sick time and paid family and medical leave, because I know you all are working and continuing to work on a campaign for comprehensive paid family and medical leave, and would love to hear about that as well.
Yeah, thank you, Sarah. This was a huge victory for us. Women Employed has been working on this bill for 15 years. And thanks to a broad coalition legislative sponsorship, we're expecting this bill to become law this month when Governor Pritzker signs it. The bill applies to full and part-time workers of employers of any size, and it provides workers with up to 40 hours or 5 days of paid time off. They can accrue it at 1 hour of leave for every 40 hours worked. So if a worker works 20 hours a week, it would take 2 weeks to earn an hour of leave. The accrued hours, this is important, can be used in increments of 2 hours. So you don't have to take like half a day off or a full day off just because you need to go to a doctor's appointment, for example. The employers can require a waiting period though before leave can be used. One thing I will point out is that our work on this really began as paid sick leave, then kind of was evolving into paid sick and safe leave. But the biggest change that we encountered as we were negotiating was the shift from paid sick and safe time to paid time off for any reason. So with this legislation, workers can take paid time off to go to a doctor's appointment, but also to see their kid in a school play, or because they want to take some time for vacation. And Maine and Nevada have similar paid time off bills. It was the business community that was behind the shift to paid time off. They didn't want the administrative hassle that came from reasons for leave. But I think the other thing that's interesting is that in a separate kind of like study we did, we found that there were some workers who didn't utilize or were concerned about utilizing any kind of leave for like domestic and sexual violence if they had to tell their employer why they needed to take it. And sometimes when you have leave that's very specific, you have to show that it's like for eligible use. So that was kind of an interesting thing that came up, and hopefully gets this paid time off allows for that to be more easily used. As you noted, though, this law is a huge step forward. We worked on it for 15 years. And we are nothing if not relentless when it comes to women's economic justice. So it's all about managing short-term needs, and the fact is that people have medium and long-term needs as well. And so it doesn't protect people who have longer-term leave that they need to welcome a new child, to recover from more serious illness, injury, to manage long-term care for a loved one, et cetera. So we have convened a statewide coalition, and it's recently been relaunched as the Illinois Time to Care Coalition, because that's ultimately what this is, right? It's time to care. And we're advocating for the passage of a statewide Family and Medical Leave Insurance Act that will provide paid job protected leave to manage those longer term care needs for them, for workers and their families. So it would create a state-run insurance program that would allow Illinois workers to use up to 26 weeks of paid and job protected leave. We've included in the bill allowance for the money that people get paid for the percentage of their income that they would receive during that time to be higher if they are in fact earning less, because we know we need to make it financially feasible for it to truly be inclusive, right? So, right now, 62% of Illinois families can't take unpaid leave without risking their jobs or their family's economic security. And it's really past time to change that. So we're really excited about this next front.
Thank you so much, Sharmili, and huge congratulations on that victory, that very hard fought victory. These are long fights and campaigns, so thank you. I have one last question that I want to pose to the group, whoever wants to jump in, and just a reminder that folks can also put questions into the chat. Hopefully we'll have a few minutes there. And I warn, if others don't have questions, I have questions, so I will jump in on those. But before we get to that, can you all talk a little bit more and close out with how workers and advocates can engage in leave work, both in terms of the laws that we already have on the books and in terms of advocating for new laws? And Sherry, I'll start with you.
Yeah, I mean, I think we talked a lot about the outreach and education that we need to be doing and how to do that. We talked about that in the beginning, and I think that's definitely something that's ongoing. It isn't just about passing laws, it's about making sure that they work. And so engaging with the enforcement agencies and making sure that all the materials and regulations that go out to the public are correct and are really distributed well, because it is the job really of government to do that. They don't just always do the right thing. And so I think that, advocacy is very important in making sure that particularly states and localities, and honestly, having worked all around the country on this and passing paid sick days laws that are very small, many of them don't have the resources. So they really do depend on advocates to make sure that that the word is out there. So really working with them and working with community groups and your own groups on the ground. I would also, we are an organization, we're a legal organization. We do a lot of legal work. We've written most of the paid sick days laws and the paid family and medical leave laws around the country, or at least contributed to them. We are a resource. We really recognize that the real work is being done on the ground, but we really want to be a resource to everybody who's working on these issues. And we have model laws on both paid sick time and also on paid family medical leave. And we have thought very hard with a lot of other people who have thought very hard about what is equitable, what is going to be universal, what is really going to make it so that these laws will work. So we really urge you to be in touch with us and see, we're just here as a resource and to be helpful to anybody who's working on these issues on the ground.
Yeah, exactly like Sherry said, join your local community organization. There's motherinjustice.org. In Michigan, there's Detroit Action that does a lot of work with small businesses. I mean, literally the list goes on and on, but join your local community organization, find out what type of issues they are focused on, if that aligns with your values and who you are and your spirit, and if it aligns with what you believe in. I will absolutely say join those organizations and really join in the fight with them. Mother and Justice has a Mama March every May. Go to the lobby days that we have. Join us in we call community conversations. We call them Mama's Conversations, as we affectionately call it. And we also have fellowships that we have every single year to help you understand how you can be a better community leader. And I know like some of us just come with like that passion in our heart and we want to do it, but we really don't know like what's the pathway to doing that. I'm sure that's how most of y'all came to the movement. That's how I came to the movement. It's just, you know, why the heck I got no paid leave? And that's all I knew. And so it took some time for me to kind of understand like how to become an organizer, how to become a community leader, how to get active. And that's what Mother and Justice provides you with these fellowships. Oftentimes they're paid fellowships too, just to add a little spice to it, you know, to get you more activated. But, you know, there's lots of things that we offer in these community organizations so you can be heard and understood and your voice is out. And last thing I'll say about Mother and Justice is our Mama's Agenda was curated by mamas, right? It started with Danielle Atkinson at her dining room table talking to mamas about what issues matter to you the most. And so, and we keep that essence at Mother and Justice by curating our issues around what the needs are of the community. And so when you become a part of these community organizations, that means that we're curating around the conversation that we have with you. And so, but if we don't have you, we can't curate it around you. And so that's why I always say, let your voice be heard and find your local community organization so they can focus on the needs that will help you the most.
I mean, I couldn't say it more powerfully than Aisha just did. I would just offer that in Illinois, we would welcome you to find out more and to join us at iltimetocare.org. I think our stories are the most powerful thing that we can offer. And we are always looking for people to share what their stories are, not just to, you know, get someone to pull on their heartstrings, but these are real, right? This is the real cost it is to our society when we don't provide the kind of universal leave that Director Chun was talking about. So we have to illustrate it, we have to drive it home, and your voices are so, so critical to making that happen.
I would love to add as well, and probably just reinforce a lot of what you all shared. I'll take the opportunity again to make sure that everybody knows about the Women's Bureau's Fostering Access, Rights, and Equity grants, FAIR grants, just making sure, like each of you have said, that workers do know their rights, that they're able to access the critical income supports, including a lot of those that have been made available in response to, you know, some of the COVID relief legislation, whether at the federal level or in your states. This is really, Aisha, to your point, this is really work that is led by folks who are from your communities and who know what your communities need and who can help to break through some of those information barriers that we've been talking about. I would also really invite people, like, please be in touch with the Women's Bureau. We have regional offices and leadership all across the country. Because of the FMLA anniversary and because of all the work that we are committed to on these issues, a lot of our regional teams are actually hosting conversations, hopefully with many of you across the country. We had a great event yesterday in New Jersey. A big part of the conversation was talking about the FMLA, but also talking about New Jersey's paid leave law that's been longstanding, and connecting it to things like maternal and child health, but also the health of workers and their entire families. And then I see another opportunity, which is to really keep conversations about investments in built infrastructure, keep those connected to the kinds of investments that we need to see in our care infrastructure in our country. So there's, a lot of attention right now on ensuring that women and women of color are gaining access to the infrastructure jobs, and knowing that women still do the majority of our family's unpaid caregiving, and the fact that that unpaid caregiving responsibility, whether it's for our kids or our elders, our loved ones with disabilities, is sometimes that barrier to tapping into a new job or a new skill, new skills that you need to enter careers like the skilled trades or manufacturing, or gaining, new credentials to get into a new line of work. And so just the opportunity in front of us to keep the focus on not just what makes for a good job and a quality job, but also the kinds of social insurance programs that we really need to establish to ensure that more income and employment security for all workers, and especially for women.
Thank you all so much. This has been incredibly informative and enlightening. Also really want to give a thank you to the Biden administration, to the Secretary of Labor, the Deputy Secretary of Labor, who have been all talking about the need for paid leave. And President Biden most recently mentioned it in the State of the Union address. So we are hearing about paid leave from the highest levels of government, which is incredibly important. And something really interesting, Wendy, that you just mentioned in terms of tying care to other policies that have come down, a really interesting development in the last couple of days around the CHIPS Act and those who get funding for chips, and that infrastructure, really important infrastructure, needing to also provide for childcare in their business. So there's really exciting and innovative ways that the administration is working on these issues. And just want to thank you, Director Chun, Hoon, for all you're doing in that space and all the administration is doing in that space.
Right back at you. Thank you.
Okay, we have time for a couple of questions. And someone had asked what the difference is between sort of maternity leave, paternity leave policies, and the paid family and medical leave policies we're talking about. And would it be better to just focus on FMLA and strengthening that versus paid leave policy? So Sherry, I'm going to turn it to you to kind of break down, when we talk about FMLA, when we talk about paid leave, how does parental leave, maternity leave, paternity leave factor into the programs we're talking about?
Yeah, I mean, the FMLA covers, parental leave and, for a new child, but also your own medical leave and that a serious illness of a family member, close family member. And the laws that we're passing now in the states are using the FMLA. They just use the FMLA expanded family, but the purposes themselves are the same. So it is a form of expanded, FMLA leave to an extent, except it's paid. And that's the key, because we talked a little bit about the eligibility barriers to even being eligible for FMLA at all. And we do want to work to make sure that those fall, but nevertheless, no matter how many people are eligible, even if everyone is eligible who is a worker in the United States, there are so many people who can't afford to take the leave that they really need for these purposes if it's not paid. And so that's why we really need to be doing both. We need full job protection, certainly, for these purposes, but we also need to have a system for being able to pay for it. And the successful systems in the states have been social insurance programs where a little bit of money is deducted from people's paychecks, employers contribute, and it goes into a fund. It's really pennies that go into a fund. And then when workers in the state need pay for those purposes, which do tend to be the FMLA purposes, they can receive that pay. And so, you know, it is both. We do need job protection, and we do need but we do also need pay. So many people cannot afford to take time off unless there is something there for them to live on. So that's what I would answer. I hope it answers the question. I wasn't entirely sure what the either or was, but hopefully that addresses it.
We also have a question around the need to exhaust your vacation or sick time first when taking FMLA. Is that the case, that you have to exhaust all of your vacation or sick time first before you take FMLA?
No.
Okay, there we go. Plain and simple. Thank you, Sherry.
No, and I would say also it is an issue also in the, as you know, I'm sure you said, can say in the proposals that we're doing, in all the state proposals, there is in terms of paid family medical leave, there are ways in which sick leave is dealt with, and what we're trying to say to people, or we're trying to say in these bills, is it's up to the employee. And, you know, particularly for paid family medical leave, because often the guaranteed pay is less than your full pay. If a worker wants to take that, you know, they can. And even more so with FMLA, if a worker wants to take their leave because they want the pay, they can. But it should be the best policy is that it be up to the worker.
And someone asked, is there a move in Congress to address the people who are not covered by the FMLA? So those 40% of workers who don't have even job protected unpaid leave.
Yes, there's a proposal that was introduced in the House of Representatives last year, and I'm not sure whether it has already. I think it has already been reintroduced for this session as well. So and there will be a coordinating bill, at least, that's being worked on in the Senate. So there are those proposals. Unfortunately, given the makeup of the Congress at this moment, it doesn't look so good that you know, to get those over the finish line. But I think it's really important to keep making sure that those proposals are made and that people throughout the country understand what the problems are with this very important bill, the FMLA, that protects so many people, and how important it is for it to be able to protect everyone.
Thank you so much. I think that brings us to the hour. I just dropped in the chat Representative Underwood's bill, the Job Protection Act, which is sponsored in the Senate by Senator Tina Smith, which would close those gaps. So I want to end there. Thank you so much, Director Chun, Hoon, Sherry Leiwant, Sharmili Majmudar, Aisha Wells, for joining us today. Again, this webinar was recorded, so we will share out the recording along with a lot of the resources that were mentioned. We put some of them in the chat, but we want to make sure you have those on hand. Thank you so much to everyone. Take care.
Thank you.
Good to see you guys.
You too.